I'm a health policy consultant. I work out of San Francisco. So I do actually mostly domestic work now, so domestic policy around Medicaid and Medicare and the new health reform, the Affordable Care Act. Rewind 5 years, I'm at Northwestern and I'm graduating, and I'm interested in healthcare. I've been interested in healthcare largely because of the global health minor, and I did my abroad program in Mexico City where I worked at a big hospital, and I was looking at hospital-acquired infections, so infections that patients were getting in ICUs and in the hospital there. Sent my resume out to a bunch of places, and I got a phone call the next day from the University of Chicago. They had a program there where they were looking at infections in the hospital, and my resume had floated to the top because of that work I had done in Mexico City. So I would like to say that my global health abroad experience really launched my career in public health. So from the University of Chicago, I went to DC where I did some more policy work. I found that the clinical research wasn't really giving me what I wanted. I wanted to work at a population level. So I went to DC and did some policy work. I did some work for MedPAC, which advises the Congress on how to make policies around Medicare. That's our health insurance for the over 65 group. And then I found that I didn't quite have the skills that I wanted. The global health minor had prepared me very well, but I needed some higher level courses. So I went and I got my public health degree at Harvard. There I took courses, biostatistics, epidemiology, those kind of general courses that are required in all public health programs. But I was also able to dabble back into global health. So I was lucky enough to spend some time in India doing research around family planning. And I actually took a course at MIT that was an interdisciplinary course with some people that were developing technology at MIT and some people at Harvard that were trying to take that technology out into the field. So very similar to the program here at Northwestern. So overall, I thought that the global health minor really gave me some interesting context into the healthcare system. I learned a lot about the social factors and the environmental factors of healthcare delivery that apply abroad, but also apply here in the United States.